Hello and welcome to the Bitcoin Mentor podcast. Today I'm very excited to have Emma join us. Hi Emma, how are you?
I'm good, thanks. How are you, Jake?
Yeah, I'm really well, thank you. I'm pumped to find out more about yourself and your story into Bitcoin and why you're a Bitcoin mentor, which is the format of these episodes we've been doing. So I always start in the same way. It's really kind of a history lesson in some senses, like wind the clock back to when you're thinking, okay, I'm a teenager or wherever it might be that you feel is appropriate to start. But I'd love to learn more about who you are, Emma, and what life was like for you growing up.
Yeah. So, man, there are many things that kind of shaped who I am today and ultimately what's led me to Bitcoin. I would say one thing is I've always had a very strong passion for learning, and this was encouraged by my parents. And I grew up in Toronto to a multicultural family. My mother's from St. Vincent, a small little island in the Eastern Caribbean, and my father's from Ghana. And both of them really cherish education and the things that education can afford someone who is dedicated to learning as much as they can. And so I took that very seriously also because I saw how they worked and also how, in some respects, they didn't have the same opportunities that I had. So, for example, my father, when he actually moved to England when he was probably in his, probably maybe mid 20s, 30s, around there. And that's where he met my mother in England. And he had to essentially leave Ghana because the financial situation there was very, very grim, unfortunately. And my mother, coming from a smaller island, you're just looking for additional opportunities to grow because essentially there's only so many kind of career pathways you can consider. And so, spending some time in England, they pursued careers both in the health sciences. My dad pivoted after that, but my mother's a nurse. And they moved to Canada. My mother had family here. And so, yeah, and so I was born essentially here. And I just always heard their stories around how lucky I was to be in a place where there's just so much opportunity. So I took that very seriously. And thankfully, I really enjoyed school. And I think part of that was because I enjoyed sports. I was a dual athlete. And I also wanted to travel as well. I saw my parents had the bravery to travel as well, kind of in their younger years. And I also spent time in the UK growing up because I have family there. And so I had that spirit of learning, travel, and also sports. And I was able to get a small scholarship to play basketball and soccer at a small little school in Maine. I studied biology, chemistry, and it was actually through a bachelor's of art. So in the curriculum, there's courses sprinkled in around psychology, like the social sciences. So I got a nice breadth of different things. But admittedly, I probably spent too much time on the sports. School kind of was second priority. It was still a great experience. I did end up doing some laboratory science research in mass spectrometry. Essentially, I was just looking at these like proteomic specs and just looking at different diagrams all day. And my supervisor was very passionate about it. And I was very interested, given that it was new material for myself to learn, but I just didn't feel like my passion was there. So when I finished my BA, I then found myself in a position thinking, okay, what am I going to do? I think this happens to many people after they
Yeah, who am I?
finish. Who am I?
Yeah.
Exactly. I've done all these things. I've learned these things. Now, what do I do next? And so I returned back to Toronto and I got a job at a local university health network. And because I had some of that laboratory research experience, I guess my resume was attractive to this doctor that was doing research on essentially nerve blocks for surgery to numb pain. And I was introduced to like systematic review, like literature review methodology. I was like, oh, this is kind of interesting, but it was a volunteer position. And then from there, essentially, I need to find paid work. And I was able to land a position in a patient education department at a cancer hospital here. And I was paired with my director, an academic. He was amazing. I would say is still a mentor to me to this day. He essentially took me under his wing and he showed me what patient education research is all about. So I was there for about 2.5 years, did a lot of research around patient access to the medical record. This is at a time in Canada where we're still trying to understand how to give patients access to their electronic medical record. And there's a lot of fear that, patients getting their medical records at home, this would stimulate a lot of anxiety. But what we found was that patients really appreciated having their results because it provided them with a sense of empowerment. So I was able to co-author a number of papers on this work, which is fantastic. But, with a bachelor's working in a research environment in an academic setting, you kind of hit a ceiling. And so I had to explore my options, and I was exposed to public health because a lot of also what I was doing outreach and talking to local community groups around the services that the hospital was offering in terms of their patient education medical record, and then also the Cancer Survivorship Center in general. So I really like this health education aspect, and this is a part of public health. And for those that are not familiar, I know public health is a term that's been thrown around, and unfortunately, we've all come to know what public health is through the past pandemic. But public health is essentially what we as a society decide to do to prevent poor health outcomes and to address disease. And so it's a very broad field. The science of public health is something called epidemiology, where you can look at statistics to look at trends of disease. You can look at health education, which is essentially health promotion. And so that's a branch of public health that I got really interested in, this health promotion aspect. And after identifying that health promotion was an area that I was interested in, I then went to Atlanta because we were close to the CDC. And when you're in public health, it's just a fascinating kind of environment to be near. And I had some fantastic professors that I was around. And I got into, interestingly, it's not really where people at an entry level get into public health, but around academic curriculum design for public health professionals. And so I did some work in that area. And then I also did a project placement as well at Georgia Tech. And I was doing health promotion in their office. And from there, I then did my doctorate at East Tennessee State University. And there I actually pivoted a little bit into kind of disaster sociology. And my thinking here was I really wanted another opportunity to travel and to learn about a new culture as well. And so I ended up conducting some studies in 2011 around the 2009 earthquake and tsunami that hit American Samoa. And the human response there was really good, given that the earthquake was an 8.1 magnitude. So a lot of lives could have been taken. And so I worked with some local interviewers, and we tried to understand what people did to have such an effective response. And after those studies, I then asked, okay, what do I do next? And I just applied to several positions, given that I had kind of this academic trajectory working at the hospital, the University Health Network. I decided to apply to some academic positions. And I got a position at the University of North Florida in their public health department, taught some undergraduate and graduate courses, specifically in public health. And then I wanted to come closer to home. And so I applied to a director position at McMaster University, was the Master of Public Health program there. And then actually last year, I stepped down from my full-time position to fully pursue being a Bitcoin advocate, and happy to talk about that story as well too.
Well, I mean, in some ways, Emma, we can just kind of stop the podcast there. Amazing initial introduction. There are just so many things I want to ask you about, having told me all of that. So we will do our best, to anyone listening out there, to get through the cool bits. Originally being English, I'm intrigued about that. So mum and dad both emigrated to the UK. Like, roughly when was that? And to draw on that idea of opportunities and seeking opportunities, teach us a bit more about like the rationale for them doing that, and then how that, has obviously transpired to hugely influence yourself.
Yeah, so I think it was probably maybe in the 70s or so. And, if I look at this from a Bitcoin lens, you essentially see that unfortunately opportunity is not equally distributed. And essentially, in some part, that is life, right? But again, from a financial perspective, you can see people that come from certain places have to move other places so that because they're better supported through the money printer, if you will, or have more opportunities to find because, Britain was a past reserve, the United States is another. And it's just so interesting that these countries have more of the opportunity there. I think both of them moved there because, again, there was family there. So my mom comes from a pretty large family, I would say, and there was family already there. And so she could easily integrate into the British system there. And I think for my father, there was just a lot of Ghanaians there as well, and the same thing. So they were able to find more educational opportunities that could then propel them to the next step. And I think during that era, you would find that I think also the UK was looking for labor. And so they opened up kind of the immigration doors to, and I know this is a very hot button topic right now, right? To people from like Commonwealth countries, etc.
Mm-hmm. It's funny, like migration comes up as a topic in modern newspaper rhetoric. One feels like it's, every other article often has migration as part of it. And I didn't realize until relatively recently that actually, if you find a newspaper from 100 years ago, the same subject is just as popular. It's an age-old discussion that people have obviously had forever, right? Like that more Austrian economic, individualistic perspective that perhaps either you knew of before Bitcoin or Bitcoin teaches you. Why shouldn't someone follow the best opportunities they can find? And it just, it changes from country to country at different eras and based on policy and all sorts of different factors, right? It makes sense for people to go to certain places because of family or the weather or whatever. Okay, so 70s UK, mum and dad met, epic. They then decided to go to Canada. To fast forward a little bit then, you talked about going to university and being like a dual athlete. I don't know what that means. What does that mean when you're a dual athlete going through uni? And I would imagine that mum and dad were pretty pumped that you'd made it to that stage, right? That was the whole point of moving to another place for more opportunity.
Exactly. Yes. In my immediate family, I would say probably the first one, like in my nuclear family, to pursue further in education at that level. And so, having a sports scholarship, leadership scholarship really helped out to make that dream a reality. So essentially you're playing two sports, and it's very grueling because you have practice times in the morning, and then you also have to study. And I probably didn't do as well as I should have in my undergraduate studies, but I was very interested in just pursuing this dream that I had growing up to just play sports abroad. Like growing up in Canada at the time, we didn't have so many opportunities to take sports to that uni level. Like there definitely was, but as you probably know, in the States, the opportunity is just much greater. A number of us who played like basketball or soccer competitively, we always looked to the US to catapult us to that next level. Some people were like, "Oh, Emma, you should shoot for the WNBA." Admittedly, I was not that good. I was not that good at all. Um, but it's always nice to have pipe dreams. I think
Course,
I
of
was
course.
good enough where I could hang with actually the boys a little bit.
Yeah,
I'm like a shooter on the perimeter. If you forget about me on the perimeter, then you better watch out.
yeah.
And yeah.
But it's good. It's good to have dreams, though. This is something that we often forget, right? We get caught up in the stress of life, and you're either going for a career or whatever you might be doing with your time, and those dreams that one had as a younger person, they kind of get shelved essentially during that process. Um, and so it's fun to reconnect with those things. And so you're still an active athlete today?
No, unfortunately not. So I would say maybe I think 4 years, 5 years ago, I tore my Achilles,
Oh no.
and thankfully I didn't need surgery. I've recovered, but I've said to myself, I should not probably compete as intensely anymore.
Okay. So I was going to ask then. So it was basketball and soccer that you played. Yeah, cool.
Yes.
Okay. And so from there then, so you went on to mention something that's a word I have to bring up. So you went to uni and you started getting involved in this kind of public health space. And you mentioned that you had a character in your life who was a mentor. Obviously, we're here because of Bitcoin mentor. And there's a very different relationship with a mentor than different types of other kind of labels you might give someone. So when you think of this person as your mentor still today, like talk me through what that friendship was and what you learned from them.
Yeah, it's actually an interesting story. So I think I told you that when I finished uni, I had kind of this like volunteer position where I was doing research and then I had to look for paid work essentially. And so my resume, I believe, was in a central pool. And I think in that central pool, employers who needed people, where the resumes matched their needs, they would then call on those applicants. So I remember getting this call from the patient education department for an interview, and I do not remember applying to the position, but somehow I think I might
Okay,
have.
I'm
I
coming.
don't
Yeah.
know. I don't know. So the interview was really interesting. I honestly, like, I tried my best. I didn't even really understand what the position was because while the position was in patient education, it was in educational informatics. And that was a branch of kind of like healthcare, public health that I didn't really understand. But my mentor, he said that I just loved the fact that you tried to answer all the questions in the interview. And it seemed like you had bold ideas that you wanted to share in the work environment. And so he really appreciated that. And so he saw something in me. And clearly at the time of the interview, I wasn't seeing anything myself because I didn't even know, what I was really, I guess, applying for at the time. And so just from there, he just would, follow up on me, like when I would go back to school to do my master's, for example, in Atlanta, doing my doctorate. He would share opportunities to say, hey, there's this interesting project. Would you be interested in collaborating? So he just continued the mentorship and he gave me the space to grow as well. He could have admittedly sheltered me and say, why would you want to go to the States? We have great quality education here. You've already built a career trajectory or starting to build one here. Why would you go away? but he was just incredibly supportive. So I think mentorship is critical in kind of whatever it is that you're trying to pursue at a high level.
Yeah, it's funny, isn't it? Much like what we're doing now with this podcast. Traditionally, we would have sat around a campfire and talked, and that's how wisdom was kept and generated and stored over time, from generation to generation. So in many ways, like that's that's a fairly simple rule of life, isn't it? To have someone who can teach you about what might be the appropriate way forwards. How cool. And to make the reference to Bitcoin Mentor, I very much see that playing out for the business in terms of people making contact, getting help. The Bitcoin journey is never ending, and therefore there's going to be always areas that you can shape up in as the technology flourishes or as your understanding changes. Before we get to Bitcoin Mentor, though, I want to keep talking through some of these experiences you've had. And so next, and forgive me, I'm being English and based in Australia. I'm not that familiar with the States. I have to ask what it was like working in it. So you mentioned Atlanta and being close to the CDC, and you also mentioned doing a PhD. Was that over like a long period of time, or maybe that should be two different questions? But what was it like working in and around the CDC, and equally, what does it mean to do it? So you mentioned a doctorate. Is that a PhD? It's the same thing.
So the master's is a 2 year program. And given that I studied at the CDC, most of our instructors had appointments at the CDC. And so it was interesting to learn kind of, I know the CDC could be a little controversial given your kind of perspective on things, but I think if you're just looking at a pure kind of scientific perspective of the methods and just learning from people that have done these things for several years, it was a very enriching experience. And so, yeah, that was a 2 year experience. And after that, I actually got an applied doctorate because for me, I didn't want to just learn the theory behind things. I wanted to ensure that I could apply theory to practice. And so in public health, there's something called DRPH. And interesting enough, I did apply to the PhD program and applied to do it in Canada and got in. But again, my passion was really with that applied learning experience. So that was about 3.5 years. So in total, my graduate experience was about 5.5 years.
Wow. And I like the emphasis on applied learning, because I mean I certainly am like this. Put me in a situation where I need to figure out how to solve the problem, then I'll figure it out. But sit me down and teach me a lot of theory which doesn't actually apply to any scenario. It doesn't sit the same. It kind of goes over the head in a sense. So perhaps we learn in very similar ways, because other people obviously like to sit down and be given a textbook and told, like, this is it, figure it out from that perspective. Um, okay, cool. And so you also mentioned this idea of going to American Samoa and doing a study there. So you're out there collecting data specifically from people. So that's like a primary research project. You end up at the end with a thesis essentially that says, this was a good job or this was a bad job.
Yeah, so essentially, I chose the alternate format. However, I feel like more and more learners are choosing the kind of three manuscript type papers that can then be published in a scientific journal. So my work has been published in several scientific journals documenting this experience. And essentially, I use this theoretical model called the protection action decision model that looks at various factors that inform someone's decision making during a disaster situation. So you can imagine it's demographics, it's how close you are to the source of the disaster, for example. There's all of these things. And so essentially took some of these uh, constructs and then tested to see, okay, what were people's outcomes. And essentially we translated that all on a survey, and so asked people a series of questions, and then those questions would overlap to the different factors. An interesting one that I really a study that I really I think appreciate that I did was looking at unemployment rate and seeing how that affected people's trust in stakeholders when giving kind of like disaster preparedness information. And the results are not alarming, but those that were employed were more likely to trust these stakeholders who gave the news information. And so for me, I just highlight that how demographic and income, socioeconomic status can really play into people's perceptions of things, whether it's a disaster or whether it, I mean, in this case, to adopt Bitcoin or not, for example.
Okay, and so what's the incentive for actually doing this work in the first place? Who benefits from it? Do you sell that to someone at the end, or like someone makes a decision as a result of it? Why do you go and do all the work?
So the whole purpose is to inform emergency managers around people's thinking in disaster situations so that they can help communities prepare for disasters. If I'm completely honest here too, kind of being an outsider, traveling to a different country, it's kind of playing into, in some regards it could, to kind of this helicopter science, right, where outsiders come in to a local community. I would say, admittedly, for myself, I wish I had more of a deeper kind of connection to the place to keep supporting like the emergency managers. I just highlight that for people that might be listening, especially younger people, is that you just want to ensure that you're embedding yourself into a topic where you can make an impact.
Awesome. You may or may not have listened to many podcasts of mine in the past, Emma. I don't know, but just as a brief insight on myself. So I think of myself as an investor. My father sadly died as a younger man. He was only 48, and I received an inheritance in my 20s. And so for over a decade now, almost 15 years, I've been trying to figure out, well, like, if you get given money, what do you do with it? And it's natural that you start investing in things. And Bitcoin is this incredible tool that basically does that for you. And so I think of Bitcoin now as like the best inheritance tool that's ever existed, a savings technology essentially. But one of the things that I learned through that experience that I really valued is, unlike taking exams, you can borrow other people's research and you can make investments because of it. In particular, you can actually just copy the investments that other people make. If you find people that you think you can trust and you think have specific type of expertise and insights, you can invest alongside them. Now, I was using this technique previously to choose early stage startups to invest into. But with Bitcoin, every single person I speak to that has adopted Bitcoin in a meaningful way represents someone whose knowledge, expertise, career I can leverage to augment my decision making. Does that make sense? And so
It
you've just
does.
run me through an incredibly high level career in academia, scientific research, and analysis. And there's probably a number of other kind of cool labels we could give it. But why do you like Bitcoin so much? And how does it hold up against this kind of very rigorous kind of process? It's like, okay, well, why choose Bitcoin? And I'm really fascinated to hear how this kind of pulls together. Like, when did Bitcoin come into your life? You probably dismissed it a bunch of times as complete crap. And then you're like, actually, I've got to take another look at this. Um, yeah, teach me about that.
Yeah. So I would want to say that if you look through my journey, you may see maybe a thread of interdisciplinarity, right? Like,
Mm.
while it might
Yeah, it's not just
be
one sport, it was
um,
two.
exactly.
Yeah.
Exactly. I don't know if that's an artifact of me just like getting bored very quickly, or I'm very fascinated with just different things in life and experiences. And I would say that's probably one of the reasons why I identified Bitcoin. But I came across Bitcoin, like, I think it's hard to say when did you first hear about Bitcoin? I'm sure I heard about it maybe 2013, but then probably dismissed it. But for me, a real turning point was the pandemic. Being an administrator in the thick of the pandemic, academic administrator, was, I would say, incredibly difficult, right? Trying to support public health students. These are also physicians, also, some of these are nurses. And I'm just thinking, what is the best way that I can help? And then also, admittedly, I was, thinking about myself. Like, I was feeling also kind of anxious around my future and just seeing also how kind of asset prices were ballooning, and I just had many questions. And so I I don't know if this is an existential crisis or something, but I really had some big questions that I wanted to answer, and it brought me down to fundamental questions such as what is health, right?
Mm.
Because I think there was, during the pandemic, this sense of a collective. In some respects, that could be good, but when you break it down, there's no such thing as collective health. We're all individuals that have individual needs, right? And we need to make the best decisions for ourselves. So I was kind of thinking through that. I was also thinking about, okay, next chapter of my life, what do I want to be doing? And so, like any good millennial, you turn to YouTube and you look up videos, right? And I came across a YouTuber who was a physician and actually left his job. And he was a YouTuber kind of while he was doing his medical studies, but the YouTube channel just like went bananas. And he also, I think, had some questions around like, is it better to serve one patient at a time? Or I had this YouTube thing where I could really reach many people. And so he kind of went down that path. And he talked about a range of different topics. And Bitcoin and crypto was the thing that he talked about. My ears kind of perked up for some reason. And I was listening to what he was saying. This is the future of money. And the messaging around Bitcoin and crypto is kind of clouded together. So at that time, I didn't really understand the difference. But uh, from listening to him, I started then thinking about some of these public health theories that I've learned over the years. And there's something called the Friedman Health Impact Pyramid. And at the base of the pyramid, it shows that if you want to have the greatest impact in health and public health is at the socioeconomic layer. And at the top, you move up to clinical care, where you can help, a patient at a time. And I was like, that is very interesting. If this crypto Bitcoin thing is the future of money, but yet we're not really talking about it in public health and healthcare, I think there's an issue here. And if this is an issue, I need to learn more. And so from there, I started just reading all that I could. I
Down
listened
the
to
rabbit hole.
more, yeah, more podcasts. And I was like, oh my goodness, this is it. Being in health promotion and knowing that 80 to 90% of the addressable modifiable factors of health are related to where you live, your education, income, for example, and healthcare access only being 5 to 10%. We need to start talking about money, right? Because it is a big social determinant of health. And from there, I just couldn't stop. Again, I couldn't stop going down the rabbit hole. And I just wanted to kind of stimulate discussions around Bitcoin. And I found myself kind of being alone in some sense. I'm not sure if you experienced this in
Yep.
your journey.
Everyone
So
thinks you're
then I
completely
went,
mad. Mm.
yes. Yeah. So then I decided to go to the first Canadian Bitcoin conference. and started meeting people. And then a question I had was, where's all the women?
Yeah.
There weren't many there.
Yeah.
And so I thought, well, maybe I can start a educational startup and consultancy. So I started Dream Grad Academy at the beginning of this year. And the aim is to reach out to women and just the general public at large, anyone that's kind of interested in just learning what Bitcoin is. And I happened to see the Bitcoin mentor call on Bitcoiner jobs. I'm like, oh, that's interesting. Maybe I could partner with them in some ways. And so, like Academy, I could help people, during that beginning phase. And then when people kind of learn more or want to learn more about multi-sig, UTXOs, running a node, et cetera, then I could consult with them and lean on their expertise and help guide people through their Bitcoin journey. And so that is kind of what led me to Bitcoin Mentor. I think I have gone way off from your original question.
No, no, it's brilliant. How we piece this all together is something I find infinitely fascinating. And where we're going to be 5 years from now is as a result of all of these different questions that you've asked and answered. I'm intrigued in particular by, so I've been making content for a number of years now, and I've done it in different, whether it's a tweet or a newsletter or a podcast. I've begun to think of, like, for example, this idea of being your own brand. You can just go out online, you can just start talking about anything you want to everyone at the same time. It's an extraordinary superpower that makes chatting around a campfire, like we touched on earlier, completely mental. The physician that you mentioned who had the YouTube channel, I really encourage anyone to just get up and start podcasting if it's something they think they can do. And it's because you leave a trail of digital breadcrumbs and people pick them up and they get so much value from them without you even knowing who's listening, in a strange sense. But more importantly is that the fact they were a physician and they were into Bitcoin, that was what was important to you, because you knew half of what they were talking about, but just not the other half. And so I still think we have a huge opportunity for people to start their first podcasts as Bitcoin podcasters, because no one really knows about this stuff yet. And everyone's background is relevant to all the people that have similar experiences. And so that blends together to get this really kind of cool moment. You go, oh, they've asked the right question. Okay, I need to find out more. And then here we are today having this conversation. So maybe you should be starting a podcast. I don't know about it if you have already, which I apologize about. But gosh, cool. Okay. Did you feel like the physician angle was important to the content, or?
I thought it was very important. I felt like, while I'm not a clinician myself, I thought his whole idea of, rather than working with an individual patient and starting this channel and trying to reach many people to empower them, I really like that idea. And I've also thought of ways in which, like, how can I try and reach a larger audience as well too. I haven't thought about starting a podcast. I've been on a few podcast episodes. I've been a guest, but maybe that's something I can consider
Well,
in the
something to
future.
consider for sure. For sure. And Emma, the fundamental question, what is health?
Yeah. So that is a very difficult question. So I'm working on a book actually.
Cool.
And if all goes well, maybe it comes out next year or the following year. We'll see how things go. And this is kind of a question I ask myself. And I believe health is, it's made up of, just like, remember, we were talking about the protection action decision model. Multiple factors go into how a person reacts to a disaster event. Well, the same thing with health. Health is multifaceted. It is not just your physical health, it's your mental health. I would argue your spiritual health as well too.
Mm.
I think it's a confluence of all those factors.
When you come from a career where you've been thinking about that, you're thinking about public health, thinking about, you call it health promotion, I think was the term you used. and suddenly you start asking the question, what is health in relation to money? How does that blend into it? Because there are those common kind of memes, your health is your wealth. So okay, but also what's the point being wealthy without being healthy? And a phrase I heard someone mention, so what's the point of multi-generational wealth without multi-generational health? And so they're kind of all combined, aren't they? How do they play off each other? And why is it that Bitcoin as money is an important part of what is health?
That's a great question. So I believe that and it's a fact of life. Energy is the foundation of, I would say, every human life and form, right?
Hmm.
And as humans, we need to know, or we need to learn, or intuitively, we know we need to conserve our energy. And if we are stressed, if we are working on a proverbial, let's say, treadmill, that is not good for your health, because you are overextending yourself. You're losing your energy, let's say, that could have been conserved to do something else. And I think what a lot of people miss is that the abstraction that we use, money or fiat money, money by decree, is no longer a true representative of energy, like the energy that we put in. It's being inflated away. And so people are working more, people are stressed. And so I think there is a major relationship between energy and health. And I think Bitcoin, I would love to have a whiteboard right now and just kind of draw this, and maybe Bitcoin kind of at the middle, if you had like the two at the polar ends, being this thing that's sucking up and preserving the energy, where the person can then decide to store that energy in the short term or for the longer term. Bitcoin is a way, and I would love to work, and I do work with beginners to kind of understand this concept a little bit, this relationship between Bitcoin, health, and energy.
It's a fascinating point to get to. It's such a fundamental thing. We spent however many years we spend in education. And I mean, I, for one, I did a bachelor's as well in business management and I graduated at 22 when I finished. I never asked the question, what is money? I always was being trained in how to make money. And they're very, very, very different things. And it wasn't until I started kind of really getting into Bitcoin, I was like, oh, what is money? And the answers are, things as simple as energy. It's like, what? It's just so different to how one was kind of trained to think about the money you were getting. It's like an hourly thing or whatever, your annual salary. Then you got to invest it, etc. It's like a whole unlearning process. But in particular, it's that relation to time that you're touching on, isn't it? It makes so much sense. Like if you wake up in the morning and during the daytime, you have a certain amount of energy that you can use, and you can never create more of that. You just get tired, essentially. The way that the current monetary system functions is you get, in reaction to that, fiat currency that is obviously inflating away into nothing. You're just having to work harder and harder and harder and harder to get the same amount of stored time. And you're right, it's a really important fundamental question. Okay, to take that one step further, Emma, so having worked in and around these institutions that are working on public health, you could surely make a good argument that money is a public health policy. I mean, we're just so far away from that being reality. Okay, El Salvador has accepted Bitcoin as legal tender. It's one of the few places in the world, there's a handful now that might do so. But they haven't done it because of a health lens. They've done it from a perspective of not getting obliterated by the US dollar that they were pegged to. So that's more of like a financial thing, I think. I guess it's financial health. Let's say you were suddenly in some kind of public office. How far are we from creating a policy that frames sound money, which is what Bitcoin is, as a health tool?
It's so interesting that you bring this up, because this is actually one of the things that I am trying to add to the Bitcoin discourse, is this connection between um, money and health. So in October, I'll be going to the American Public Health Association meeting and giving a talk around this topic. And I'm hoping some policymakers will be there to start thinking about this. For example, in the UK, there's a lot of momentum around this thing called social prescribing, right? So rather than prescribing people a pill, so for example, we know mental health levels have been rising, I would argue, across the world, given, inflation, social unrest, et cetera, et cetera. And so there's been a lot of attention on mental health where people are trying to use the doctor prescription example to show that you could actually prescribe someone maybe $100 to help them buy a meal. If they didn't have that $100, that might be then impacting their mental health. But however, as you and I know, like that fiat money is broken. And so it is in the short term, yes, you might alleviate that person's short term mental ill, but that's not really going to get at the root of the problem, right? So maybe if you could work with that person and socially subscribe them maybe a financial plan on a Bitcoin standard, that might help them over the long term. Again, it's a tricky subject because there are many causes of it. But if people now are thinking, why can't the prescription be, let's come up with a Bitcoin plan for this person? Maybe that over the long term will increase their mental health or might increase their well being. And I think there are some policymakers that are understanding the benefits of Bitcoin. However, I don't think there's enough policymakers that see the connection yet, but it's something that I definitely want to partner with others to share this message.
Yeah, it's a subject that has to be talked about. There's no doubt about it, and it will be in its very infancy today. So it's really cool to think like 5 years from now, where might that conversation have got? I guess my dubious hat is like the public health programs are paid for by the money printer. As we know, like governments don't balance their books, so what they take in taxes is not enough to cover what they spend every year, generally speaking. And they finance the rest of it by inflating the currency. And so even the concept of giving someone money to pay for a meal to alleviate their mental illness is only possible because they can print money, essentially. And so in an environment where they can no longer do that, what happens to these large organizations that are currently kind of feeding off the printer and are able to create handouts like this? And it appears beneficial, but yeah, I don't know. Surely the whole system in some ways is going to completely crumble.
And I think you're right. And in some respects, yeah, I think it probably will, given the very temporal nature of fiat. I think Jeff Booth talks about this, like building a parallel system, on a
Yes,
deflationary
building someone to come to.
currency.
Yeah,
Yes. So I think we just need to just kind of reimagine some of these public health programs. Remember at the beginning, I was saying public health is what we do as a society to promote health, essentially, prevent disease, treat disease. And so if that is the case, if we are going to improve our health systems, or if we are going to improve our health, on a Bitcoin standard, things are going to look very different. And I think it will be more decentralized, more local. And also, there'll probably be a transition or even a hybrid, or maybe, maybe people will get to choose what system they kind of want to interact with. I think maybe the States is an example of this kind of, it's not a perfect system at all, but the private public healthcare system, we do have that here in Canada to an extent, but we do have, our centralized Medicare system here. But I think on a Bitcoin standard, it would look totally different
yeah, wow.
because people will want to give their Bitcoin, their hard earned Bitcoin, to services that actually work. And also, they may not want to fund some of these social programs. So I think community public health organizations would really have to reimagine how they support public health.
I mean, I love these kind of conversations myself because it's like, how do we build the best society? What is a fundamental building block that currently is missing? And when people start talking about a hard money driven digital renaissance, this is why. It's like the incentive structure for organizations that are involved in the healthcare space will radically transform when they're required to work on a Bitcoin standard, and for the better. And we could probably sit here and argue that actually adopting Bitcoin is the best health policy that you could have. And people will think we're completely fucking mad for saying this stuff. But then I would say,
Yeah.
well, look at Emma's career, right? Look at all those things you've done to get to today. You can't ignore someone like yourself with that background. And that's what I love about it. It's like, okay, well, you need to start paying attention because it's a big deal. Well, Emma, listen, so an hour's flown by, and I'm like, often with these conversations, we could do, a couple more and start digging into what does a Bitcoin standard look like for the healthcare industry. But we'll have to save that for another time. The point of these is to promote yourself as a Bitcoin mentor. And so any proteges out there that are thinking of signing up, then get in touch with Emma. On that note, what's the best way to get in touch with you, please?
I would say that the best way is to go to bitcoinmentor.io. My profile is there and you can sign up. Maybe you're just starting out and you want to reach out to me in a different fashion. I run dreamgradacademy.com, and you could just send a message through the contact there and we could talk Bitcoin, talk about where you're at. Maybe you're on the fence, happy to chat. Also on Twitter, Dream Grad Academy. And I believe there is no G in the grad. It's missing. It's missing one of the characters.
Well, and we'll
I
make
guess
sure
we could
to,
link it below.
yeah, we can get them in the show notes. That's no problem. Well, Emma, thank you so much for joining us today. A real pleasure to hear your story. Thank you.
You're welcome. Thank you.